The desire of having a child is all-consuming. Surrogacy with an unlimited number of attempts is the key to successful infertility treatment. A choice of international reproductive clinic is kind of a leap in the dark. That is why it is very important to be informed. The more information you have, the better choice you can make. Infertility treatment step by step. When we are young, pregnancy seems to be something much feared, but fears change significantly with age. According to the statistics, more than 72% of people over 35 years old have difficulties conceiving a baby. In this case, assisted reproductive technologies could be a real solution. First of all, let's gain insight into issues that seem to be known to all, but still raise many questions. How babies are made. Generally, any fertility treatment needs such components as an egg, sperm, and appropriate conditions for fertilization, pregnancy, gestation. The only difference between programs is about who will take on such a role, a patient or someone else. There are such combinations. 1. Own egg, own sperm, and a surrogate mother as a carrier. It's a surrogacy with your own biomaterial. In this case, child will be 100% related to you genetically, while carried by the surrogate mother. 2. Donor egg, own sperm, and a client carries a baby. It's an egg donation program. This program is used when a woman can't use her own eggs or they are of poor quality. In this case, the baby has no genetic relation to a woman who carries him. So the baby will be genetically related to a father. 3. Donor egg, own sperm, and a surrogate mother carries a baby. It's a surrogacy and egg donation program. The child will be genetically related to his father. The baby is carried by the surrogate mother. If a couple underwent medical examinations or experienced fertility treatment before, they could know which program would probably be suitable for them. A couple should be officially married. In addition, you need to have medical indications for any treatment. A couple can contact us to get the necessary information. Then we make arrangements for the program. At this point, you have a manager who helps you with documents preparation, your visit scheduling, and medical part. It's advisable to have departments dealing with different languages in one clinic. Biotexcom Clinic has 12 departments.
Contactarea managerul coordonator prin telefon sau prin alte.
We prepare for your visit in advance. Therefore, our managers will ask you to send your medical records via email for our doctors to get to know your particular case before the first appointment. After that, we check our schedules and choose the best date for your initial appointment at our clinic. Be ready for queues at the clinic. It is inevitable due to the great number of patients. However, if the process is organized well, it's possible to reduce patient wait time. The first visit to the clinic. The first visit is an initial consultation. You'll find out what treatment is suitable for you. It's also a chance to see the clinic and get information you need. The clinic covers all expenses for the first visit, including assistance of your manager, accommodation, meals, medical consultation, medical tests, complex follow-up support. Flight tickets are not included. Our clients are met by Biotexcom driver, or they can make use of airport taxi service if arrive at night. Driver will take you to your apartment. Place of accommodation pretty much depends on the type of your contract. Within the economy package, you'll be staying in the shared villa. The shared villa is a comfortable cottage where you will be staying in your own room. But with some other couples who have similar problems, and they will give you support 100%. Within the standard package or VIP surrogacy package, you'll be staying either in separate apartment with appropriate housekeeping staff or in our Venice hotel. It's exclusive Biotexcom hotel, and all of the couples there are our customers as well. Please note that none of the payments haven't been mentioned yet. The clinic covers all your expenses during the first visit. It means you pay nothing for medical examination, consultation, and treatment planning. Treatment selection.
Prima vizita este gratuita.
The first important stage is an appointment with a doctor. He or she will observe patient's treatment from the beginning until the child is born.
Normalmente la coppia viene in Ucraina 2 volte. La prima volta
A couple needs to visit Ukraine twice. During the first visit, they undergo a complete medical examination. After that, our specialists discuss the case and decide what treatment will be best for this particular couple. Each case is individual. Thus, the treatment plan is individual as well. Treatment is chosen according to medical tests results. The first payment is made when the couple signs an agreement with the clinic. The program starts right after the contract is signed. The first difference of the Biotexcom that you will notice just from the very first sight is our relationship. I mean the financial relationships with the client are very transparent. We display our prices on our website. We display our contracts on your website. You may read through them even before you come to us. The first payment should be made right after signing a contract. Payments for our programs are divided into several installments to make you feel more comfortable and confident throughout the program. The peculiarity of our program is that we give you 100% guarantee. Our surrogacy plus egg donation program will give you the unlimited number of attempts, no matter how many tries we need to make in order to get your baby. But eventually, you will leave the country with your baby in your hands. Guarantee of positive result. What does it mean? And why is it so important? Guarantee of result means the clinic is ready to take on all financial responsibility. The clinic is confident in its service so that all patients have opportunity to see for themselves before signing a contract. Regardless of type of the program and its participants, there are 3 main components which are necessary for conducting any program are an egg, sperm, and appropriate conditions for pregnancy and embryonic development. Egg. An egg for the procedure could be yours or donors. It depends on the doctor's recommendations. So, patients signed a contract and made the first payment. Then they get access to an egg donor database, which is available only for the clinic's patients who have login and password. According to the laws of Ukraine, egg donation is anonymous. A donor gives her consent for processing her personal information that includes only facts important for the program without name or address of a donor. Egg donors must meet the list of requirements. Women should be healthy, attractive, educated, and ready to start the program. They should also have their own healthy children. Information about each donor consists of photo, 3D full-length photo, a short interview with information about herself. All donors undergo psychological examination to ensure they are mentally ready for the procedure. Important, you are free to choose an egg donor. When you come to our clinic and sign the contract, you can personally choose your donor. My sister has recommended me to become an egg donor. She's one of the egg donors here in Biotexcom, and she has already donated her oocytes 3 times. She likes everything about it, and so do I. My family totally supports me. Sperm. Sperm must be of good quality. Therefore, it is recommended to avoid ejaculation, drinking alcohol, eating junk food, and smoking within 3 days before the procedure. Usually, intended father's sperm is used, but there are cases when it is impossible to use it. In this case, donor sperm should be used. According to the laws of most countries, one spouse must have genetic relation to a child. However, in some countries, embryo donation is also allowed. It means both sperm and eggs are donors' ones. Environment. So, who will be fertilized? Who will carry and give birth to a baby? You or a surrogate mother? This issue is decided by the doctor. The most important is that the child will have no biological connection to the surrogate, as it is illegal. The surrogate is chosen by the doctor because her physiological characteristics are the most important. All candidates for surrogacy program undergo a strict health checkup. Doctors and laboratory workers check their physical health. Psychologist decides if the surrogate mother is ready for the program. According to the program terms, you need to give your baby to strangers. What do you think about it? It's not my child, and it's not related to me genetically. I will only carry the baby and give it to the childless couple. A narcologist studies women's health and her environment. Cycle synchronization starts as soon as the donor and the surrogate are chosen. Preparing for fertilization. Everyone needs to prepare, but the donor and the surrogate mother need to undergo more diligent preparations. Regardless of who will carry a baby, a client or a surrogate mother, woman's body must be stimulated properly. Main medications for stimulation generally need to be taken from 2 weeks to 1 month. It depends on women's body peculiarities. Why do we need stimulation? Stimulation of a surrogate mother's endometrium has a positive impact on embryo implantation. Endometrium should reach some particular stages of its development. Not only its thickness matters, but its structure as well. Optimal endometrial thickness for the day of egg retrieval is 8 to 12 millimeters. Its thickness can be seen in ultrasound picture the day of donor's egg retrieval. Right after that, the surrogate mother starts taking progesterone. It influences the structure of endometrium. That is the way we can achieve not only the best thickness, but also the most optimal endometrial structure. This is vital for successful implantation. No matter whose eggs are used, patients or donors, stimulation is needed. Why do we stimulate egg donors? When we stimulate donors using special medications, we receive several follicles. From those follicles, we retrieve egg cells that can be fertilized. This way, we will receive more embryos, which may result in a successful pregnancy. We puncture follicles with a special needle in a sterile room under ultrasound guidance. We retrieve follicular fluid and send it to the laboratory. Embryologists study fluid immediately and check egg quantity. Then those egg cells are retrieved out of the follicular fluid, washed, and are prepared for fertilization. Semen collection. Meanwhile, the intended father is collecting a semen sample, there is a specially equipped room for this procedure. When a semen sample is collected, man rings a doorbell and a medical nurse takes it to embryologist. Therefore, sperm and egg reach the embryo laboratory simultaneously. This is better for embryos. Extra sperm is frozen in case it should be used for further attempts if a patient doesn't have an opportunity to visit the clinic again. However, you have a better chance to conceive using fresh genetic material. In some countries, it is allowed to transfer only one embryo, although it diminishes a chance to get pregnant. In Ukraine, it is allowed to transfer 3 embryos. Choosing standard or VIP package, patients can also use PGD, pre-implantation genetic diagnosis, prior to embryo transfer. As a result, you can be 100% sure of genetic health and quality of an embryo. Several high-quality embryos and PGD give an opportunity to choose the best embryos. We perform PGD on the 3rd day of embryo development. We can also perform this procedure on the 5th day, analyzing the trophectoderm cells. PGD is not harmful for embryo development, but at the same time, it gives us opportunity to determine if there are no chromosomal abnormalities in embryos. It also makes it possible to determine the gender of each embryo. Embryo transfer. The moment of embryo transfer is the most important. A woman is ready for action, not only physically, having the optimal thickness and sensitivity of her endometrium, but also mentally. She is ready to carry a child. Embryo is transferred when it reaches the blastocyst stage, the 5th day of its development. This gives opportunity to check embryo quality. If the patient uses own or donor eggs, so that she is going to carry a baby on her own, not requiring surrogate service, a manager will stay with her during the puncturing and transfer procedures. Embryo transfer lasts about 5 minutes, and it is done without general anesthesia. The procedure takes place in an operating room, and a woman can watch the whole process on the screen. Within 2 hours after the transfer, a woman must have a rest. Then she is taken to the hotel, and she can get back home in a couple of days. After embryo transfer, a woman needs to spend as much time outdoors as possible. The most important is to avoid stress. The woman should have only positive thoughts. After embryo transfer, she starts to take medicines prescribed by the doctor to keep her hormones balanced, which is necessary for a pregnancy development. In 2 weeks after embryo transfer, a woman needs to have an HCG, human chorionic gonadotropin blood test. This test should be done in a laboratory. If the result is positive, we proudly congratulate all participants of the program and move on.
נקלט. באמת?
יואו, אני ברחוב, אני לא יכולה לצעוק, מפגרת.
תצעקי.
יואו, ובעלי לא לידי.
הוא לא על ידך?
לא, אני ברחוב.
תתקשרי אליו מיד. מזל טוב.
עכשיו, אוהבת אותך, חולה עלייך וטורפת עלייך.
אני אוהבת אותך בעוד שבועיים אולטרסאונד.
יואו, יש לי דמעות בעיניים, כסוכתק.
נכון. בדיוק מה שאמרת, נכון.
יואו.
אחרי שתדברי איתו, תחזרי אליי, תמסרי לו דש.
יגיע, בטח.
טוב, ביי ביי.
ביי.
Pregnancy. The next visit to the clinic after pregnancy is confirmed should be scheduled for the 4 to 6 weeks of gestation. In 2 weeks after positive HCG blood test. At this stage, the first ultrasound scan gives us opportunity to see not only gestational sac, but an embryo itself. In addition, we can hear baby's heartbeat. It means that pregnancy is developing normally. Later, the woman will be under the care of an obstetrician-gynecologist who will observe women's pregnancy. At the 12th to 13th weeks of pregnancy, we can evaluate baby's movements, health state, and can eliminate the risk of chromosomal abnormalities. We invite parents to witness this miracle. The woman and her baby are under the permanent care. Periodically, she undergoes laboratory, instrumental, and physical examinations, according to which we can evaluate baby's health condition. We estimate a woman's due date, and everything is prepared for the delivery of a healthy baby at term. I control ladies not to consume any junk food with preservatives. We provide them with 3 meals daily. We cook right before breakfast, lunch, and dinner. We only use fresh food. We don't have anything for later. When the weather is not perfect, they read books or do handicrafts. Generally, the group consists of 10 women. It depends on accommodation. We try to make the group smaller because it's more comfortable for looking after them. When ladies move to apartment, they contact us and we go to maternity hospital the next day. Every surrogate mother has an appointment with a chief doctor of maternity hospital for pregnancy control and follow-up. After this, all ladies are taken to the clinic where they need to have blood alcohol and nicotine tests. These tests should be undergone weekly. All women eat cottage cheese for breakfast. It is also necessary to eat fruits during pregnancy. That's why we provide them with ripe fruits. Surrogate mothers have a balanced diet and lead a healthy lifestyle. If there are no contraindications, they may exercise during pregnancy. The process of labor and birth. A surrogate mother moves to a maternity hospital 2 weeks before her due date or earlier if she has special indications or carries twins. We often communicate with ladies. We meet in a maternity hospital for having a cup of tea or a glass of juice and often have a lunch or a dinner together. So, we have close relationship with ladies. I know everything about our women because I always see them. When you have an ultrasound or it's time for you to go to a maternity hospital, I send a message with this information to a coordinator who informs intended parents so that they can schedule their last visit. In fact, it is rare that intended parents come after baby's birth. They know when you're at maternity hospital and prepare to come to Ukraine. That's why I don't worry about them. A childbirth recovery took only 1 day. I delivered a baby naturally, without cesarean section. Everything happened very fast, and now I feel great. I watched videos about everything that happens throughout the programs, and I realized that the child I carry has nothing in common with me. When a surrogate mother is in a maternity hospital, she is under the care of a gynecologist, medical nurses, a midwife, and a coordinator there. When the time comes, a surrogate mother moves to a delivery room. Medical equipment in a maternity hospital and qualifications of obstetricians are very important. Register a birth. Right after the birth, a child is separated from the surrogate mother and is placed in the special neonatal unit. Parents, in their turn, may visit the child every day and stay with him for a while. If a birth was natural, parents can take the baby in 3 days. In case of cesarean section, parents need to wait about 5 to 7 days to take the baby from hospital. When the baby is discharged from the hospital, parents take the newborn and go to a hotel or to a comfortable apartment in Kiev. Meanwhile, a surrogate mother and a manager visit a notary to sign a relinquishment of parental rights. This document is rather formal in nature because according to the laws of Ukraine, parents of the child born via surrogacy programs are intended parents.
Согласно законодательству, суррогатная мать
This norm is regulated by the Family Code of Ukraine, which is the highest legal authority when it comes to reproductive medicine in Ukraine. Now it's important to satisfy all the demands put forward by the country of intended parents. Each country has its own requirements, and managers of different departments get down to business. While the process of child registration is in progress, you live with the child in the same apartment.
În perioada perfectării actelor pentru copil,
We recommend you to see the city and take great enjoyment in sightseeing. Kiev is notable for its amazing scenery, and in addition, you will probably be surprised by incredible price-quality ratio for the most of services. How much does it cost? It is important to have a sound understanding of how much money you need to pay for the program from the beginning to the end, considering all costs and risks.
我们诊所与客户建立很亲密的金融关系。
We are building a very close relationship with our patients. They can visit our website and download all necessary documents. All prices in the documents are fixed and the same for all visitors. Our prices are also the lowest in the world, so you have no reason to worry. Biotexcom Center for Human Reproduction offers 3 surrogacy packages: Economy, Standard and VIP. We are one of very few clinics who gives 100% guaranteed results to even those couples who have already lost their hope. In other words, the clinic signs a contract with you only if we are confident we can help you. Mankind has achieved a lot in the sphere of reproductive medicine. We have managed to freeze our genetic material. We can become parents despite anything. We can get pregnant and become happy at any age. We can play by our own rules, not having glanced endlessly at our biological clock. There is no absolute infertility.